let's talk about stress incontinence first. And the most important point about that is it always happens with some activity. It will never happen while you're sitting perfectly still. It's because it's an external pressure on the outside of the bladder. So something has to happen to increase intra-abdominal pressure, which will cause, it's like if I have a balloon and I squish down on the balloon, I cough, I laugh, I sneeze, and it causes squirt out. It's not going to happen while you're sitting watching TV. All right, now there's several definitions of stress urinary incontinence. Now one is what the patient complains of. So when they come in and they say they leak with activity, cough, laugh, sneeze, that's their subjective complaint of incontinence. Now there's an objective visualization of incontinence when we examine them. So when I do a pelvic exam and I have them cough or I have them valsalva and I can see urine come from the urethral meatus, that is an observed episode of stress incontinence. The most specific definition is a urodynamic finding, and that is when they leak with a valsalva maneuver when we can see that there is no detrusor or contraction. You might think those are all the same, but they're really not. Like for example, there is a phenomenon called stress-induced urge incontinence, which basically means a sneeze triggered a bladder contraction, and it's really urge incontinence, but it would be described as stress incontinence.